Thank you. Hello, everyone. I'm Dr. Takeshi Imura. I'm an internal medicine doc practicing in Japan, and I'm really glad to be with you today, allowing me to share some of my experience and perspective on their groundbreaking product, CKAI. So, over the last, I guess, 3, 4 months, I've been experimenting with CKAI in my practice, and I found it tremendously useful and transforming. And at first, actually, I felt it could even replace me because it's so knowledgeable and trustworthy and easy to use. But as I kept playing with it, my perspective has evolved a little bit. And now I'm starting to believe that it can actually make clinical practice more fulfilling and enjoyable and effective. So, let me just share some of my actual examples from here. So, point number one. So, I guess CKAI can actually make you efficient and effective, more capable than you were before. So in this case, actually, this was a grad student coming over from Thailand, from Japan. And during his screening process, one of his tests was positive for hepatitis. And that's why he came to visit my clinic. And when I took a closer look at his test results, actually, just one of his test results was positive, but all the rest were negative. It's a mystery. And before CKAI, I would just read up something on CK or up to date, but end up referring him out to a specialist. But this time I wanted to give a spin on CKAI. So I punched in this pertinent information, his history and lab results, and how do I interpret this? And CKAI just gave me this very easy to understand overview around this topic. Then, long story short, I gave a couple follow-up questions like these, and I came to a conclusion that what actually he was having was just he was exposed to hepatitis virus during his birth, but his own immune system kicked the virus out, and he was completely fine now. And I reassured him, and actually I double checked with one of my friends, hepatologist, and he confirmed my interpretation of the results. And that really boosted my confidence. I didn't expect myself to be able to handle this type of case of complexity before CKAI, especially with constraints of time. But now, I can treat somebody whom I couldn't treat before, and I can tackle questions that I couldn't solve before. So it's an amazing feeling. I feel really self-efficient and effective. So that's one. And the second point I wanted to mention was actually that CKAI helps you to channel your time and energy into something much more important than just looking things up, browsing, clicking. And for me, that is communication with patients. So for this particular case, I had this 40-something Indian gentleman came to Japan recently, and he had some, hard time adjusting to the culture, mildly depressed, and end up having erectile dysfunction. And we decided to start an antidepressant drug for him. But the issue around here was actually one of the side effects of antidepressants is sexual dysfunction, which was the last thing I wanted to do on this depressed man. So I would usually go to drug reference or call up my pharmacist friend and wait up for half an hour or so. But this time I, again, turned to CKAI, and I asked it to compare all the medicines in the class and the antidepressants. And here, surprisingly, positive surprise, it just compared all the medicines in a very standardized way and very clear, easy to understand. And we could just pick the right medicine on the spot. And actually, we could use that extra time for more communication. So I made sure that he understood what's going to happen for the next several weeks when we start the medicine, other side effects. I took questions and made sure he understood, and we're both happy. And this hasn't happened to me before for a long time, especially these days with a lot of burdens of administration, documentation. But it just brought me back the joy of connecting with patients. It was like, this is why I became a doctor, and the CKAI allows you to do that. So it's just amazing. And the last thing I wanted to mention was this. So CKAI actually can help you dig deep into more complicated medical questions. So something like this. So actually, I guess about a month ago, I had to discuss uh, fluid management on ICU patients with an intensivist. But my knowledge was up to date up to the point around probably 2012, 2013, when I started to shift to more an outpatient. So, but I didn't want to read everything from scratch to discuss with this ICU specialist. So I just wanted the focus update. And that's, again, when I turned to CKAI and I asked for this very custom-made mini lecture for me, just for me, tailored to my interest and knowledge level. And it gave me, again, nice overview again, and I could dig deep with follow-up questions. And it's very nice. It gives you all the important practice-changing studies here. And you can even double click on that with more follow-up questions. And that's what I did. And within 5-10 minutes, I felt ready for discussion with a specialist. And the discussion with him went smooth as butter. So I just love that. It almost feels like you have like Professor Brownwald and Professor Cecil and Professor Goldman waiting for you to tutor you 24/7, taking any questions. So it takes your learning to a whole new level. So those are the things that CKI can do. So I believe now you folks all see how much I love CKI and how excited I am with this new technology. And I believe this is, it's been quarter century ever since I entered medical school. And I believe this is the biggest invention of all, at least in the field of internal medicine, definitely bigger than up to date. And it will, turn everything upside down, like how we practice medicine and, what clinicians should do as a job and what clinicians are and how we should teach clinicians of the future. So it's a huge invention, and we're about to see a huge breakthrough everywhere. And I'm really excited and privileged to be a part of it. And I hope all of you folks are feeling that way. So that's all from me. But thank you for spending a few minutes with me. And yeah, hope to see you guys back real soon.